The market is flooded with the magical skin whitening pills containing glutathione. So friends, today's discussion is going to be about the wonder molecule, the wonder skin whitening molecule, glutathione. So today I am going to tell you much about glutathione. What exactly is glutathione, how it was discovered and how it is used in dermatology practice. Glutathione is basically a thione tripeptide. It is naturally present in our body but in low concentrations. And what it exactly does is it's a very potent antioxidant. For that reason, it is also called as the mother of antioxidants. So whatever oxidative stress which happens in our body and generation of free radical and the free radical injury, what happens? So glutathione scavenges this free radical and reduces the oxidative stress on the cells. Glutathione is approved for usage in certain medical conditions like alcoholic fatty livers, alcoholic liver cirrhosis, and in few countries it is also used to treat chemotherapy-induced neurotoxicity. And during usage of glutathione for treating this condition was the accidental discovery that it also causes skin whitening. And then, since then, there is no looking back for the molecule glutathione. It's being promoted for full body whitening, for hyperpigmentation and for overall healthy glow of the skin. Now you all must know that glutathione is not approved for usage in skin whitening, although it is approved for the other conditions which I already mentioned. Glutathione is available in many forms. It is available as tablets, it is available as topical application in the form of creams, lotions, serums, and it is also available as a sublingual spray and also given in the form of the most popular method is the intravenous route or the IV drip. Now, how exactly does glutathione gives that skin whitening effect? So apart from its antioxidant activity or the scavenging of the free radicals, glutathione also has an action on the melanogenesis or the process of pigment formation which occurs in the cells. Glutathione reduces the darker pigment and converts it into the lighter pigment. It inhibits the enzyme tyrosinase and hence reduces the production of the darker pigment in the cells and gives that lightening effect. Glutathione exists in two forms, reduced form and oxidized form. Now the reduced form of glutathione is found to be beneficial, or it is mainly the reduced form of the glutathione which gives the whitening effect. So glutathione is available in many forms which I already mentioned, but glutathione is very poorly absorbed into the GI tract. So how much of glutathione actually gets available into the circulation from the tablets and pills is very low. Hence, the IV or the intravenous form of glutathione in the form of drips is being promoted widely, and it's the most popular way of administering glutathione right now because 100% glutathione becomes bioavailable into the blood or into the circulation because it is bypassing the GI tract. However, you must know that just taking the IV drips without doing any underlying blood investigations or monitoring is also not correct. So these intravenous drips of glutathione, normally they are combined with few more elements or micronutrients or other antioxidants, and they are given in a particular dosage, in a particular regimen, maybe once a week, some people give it twice a week. It all varies from doctor to doctor. And there are certain underlying blood tests which need to be done before starting with the drips. A test dose is also given so that we know that the patient is tolerating the drip or the molecule well and to prevent adverse reactions. Now, the effect of glutathione, whether it is temporary or permanent. So whatever result you get out of the intravenous drip is temporary. So after taking glutathione drips in a particular dosage or regimen, you get that healthy glow of the skin, or there may be one shade lightening may occur. Some people do not respond at all, but some people get a result out of it. One shade lighter So after a particular number of drips, you get the particular effect which needs to be maintained with the oral medication. It's not a permanent whitening which happens because of the drips. It's a temporary effect which you need to maintain with the tablets. So the result of glutathione can last from anywhere between 3 months to 6 months if it is maintained well. So let me tell you about the adverse effects of the glutathione drips. Now it can cause sometimes urticaria, hives, itching or hypersensitivity or anaphylaxis. Though these things are rare, but they can occur sometimes. So there are no major side effects of the drips. Now this was about the intravenous administration of glutathione drips. Now coming to the oral form or the sublingual spray or the creams or the serums what are available in the market. Now I already told you that the oral absorption of glutathione is very poor and we don't know how much gets absorbed into the circulation and how effective it will be. And also similar thing applies for the cream and the serums. Even though if it is available in the topical forms, so the absorption of glutathione from the applications, the topical serum and the cream is also not very good. Now coming to the scientific data what is available about the intravenous glutathione drips. Now there are not many studies or trials which have been conducted to prove that administration of intravenous glutathione is beneficial, and it is also not approved. So even though there are no studies or scientific data to support the use of intravenous glutathione, still it is being given in the health industry because people do find results. Some people don't, but some people find results with the intravenous strips. So you can consult your board certified dermatologist for the same. You can ask your queries to them, and if you are convinced with it, then go ahead with it. So if you found this video useful, then please like the video and share the video with friends whom you think it would be useful, and also subscribe to my channel. Thank you so much.